sudden overnight, things just can't get far enough away. And it's normal for our vision to start to go, as for women when we're in our 40s, for men in their 50s. But no one says to you, well, it's normal for you to lose your vision as you get older. So, just go around with blurry vision and not able. No, we're like, go get you some corrective lenses, some glasses, so that you can see
Oh, that's so
20/20
good.
again. So if
So
it's
good.
good for that, why don't we feel the same way about our hormones and our health? We probably could be crusaders for this. I would wear a big H on my chest, because I'm telling you, the few times that I've traveled and I have like left my hormones in a hotel room and had to go a week without it, you
Oh,
feel it.
yes. Absolutely. Absolutely. So as an OBGYN, you have women coming to you talking about hormones, talking about things. Um, I know that I've never discussed sex with my OBGYN.
Mhm.
How did that passion, I mean, what was happening? What women were obviously, I mean, you're so relatable. People were starting to open up to you.
So there's a thing that every doctor has. I used to have this group on Facebook called Doorknob Conversations. So what happens is every physician, people will go in, you'll see your doctor, right? And you'll spend 30, 45 minutes, even an hour on the visit. And the doctor will say, well, is there anything else you'd like to discuss? And most patients will say, oh, no, no, no. And then just as say, okay, well, no, this is what we're going to do. I'll see you next year, blah, blah, blah. And just as you go to touch that door and turn the handle, the patient goes, well, there's this one more thing. And as a gynecologist, that one more thing is usually about a woman's sex life. And so I used to call that the doorknob conversations. And so that's the thing that she really wanted to discuss, but that she didn't have the courage to
Mhm.
bring up during the
Mhm.
visit. But it's something that's been weighing on her. And so there were two things that made this come to fruition. Number one, as OBGYNs, we focus a lot on childbearing. So we help women to get pregnant. And then after your childbearing years, we don't really focus so much on your sexual wellness. Now, we put a lot of focus on men's sexual health throughout their entire life. But for women, sex is for procreation. We don't look at sex as a means of pleasure and connection. It's for procreation. And so patients after, their childbearing years, what I noticed is that the thing that most of them had problems with was their connection with their partner. Either it was because of sex was painful, or her libido was low and she didn't have energy, or sometimes it was because she just didn't feel attractive because of weight gain and not being able to lose weight and things like that. And so that was one part of it. The other part of it was I had no education in managing sex. Now, I'm a gynecologist who is a sexual health expert, yet I had like 99% of the other gynecologists in America had no education on managing sex. So when a woman would come to me and say, I just don't have a libido, I don't feel like having sex, or even if I, do it, I rarely have an orgasm. My response would be something like, well, maybe you need to have more date nights and put on something sexy. And
It's not the answer, huh?
that wasn't her problem. That wasn't her problem. But I had nothing to give her. And so what would happen is, now, mind you, it already took her a lot of courage to be able to bring this up. Now she's brought it up, and then I gave her this surface answer that really didn't touch the problem. How long do you think it was going to be until she was going to have the courage to bring that up again? So to me, again, that was malpractice. And so I said, I have to do something about this. I have to fill this void. And so that is why I decided, when I decided I wanted to leave my private general practice, to focus on managing sexual wellness, but to create a space where it's just a safe space to have these conversations, where we talk about sex just like we talk about everything else. And this is the thing. If you notice, if you come to me, Nancy, and you notice that I'm uncomfortable discussing something, if I move away when you bring it up, then you're going to stop talking about it. But if I'm open and I'm laughing, then you're comfortable talking about it. And that's what I wanted to create, is a space where not only do we manage these things, but we manage it in an integrated fashion. So I don't just focus on the physical, but we also look at the emotional, the psychological, the relational, all the things that go into intimacy and sex. And so it's more of an integrative approach to managing intimacy. And so that's why it's called Intimacy, because as you know, the most important intimate relationship you will ever have is the one you have with yourself. And until we get this relationship healthy, we will never have a healthy one with someone outside of ourselves.